Hi, my name is Dr. Jeff Cruz. For those of you who haven't seen any of my videos, let me tell you a little bit about myself. I've been practicing medicine for 20 years and am certified in general preventative medicine with extensive education in health and nutrition. Throughout my 20 years, I have studied women and men health issues extensively and have provided health consultation for numerous individuals. In this video, I would like to discuss the causes of irritable bowel syndrome and a health program to help the symptoms subside. Irritable bowel syndrome, or IBS, is a condition that is prevalent among individuals aged 20 years and above. It is one of the most commonly diagnosed syndromes, yet one most people tend not to talk about. IBS is characterized by frequent cramping of the stomach, bloating, abdominal pain, diarrhea, and constipation. Although these effects cause a great deal of distress and discomfort, the effects will never lead to something severe because IBS does not cause permanent harm on the sufferer. While there is a common pattern for most patients, the symptoms of IBS vary from patient to patient. Some individuals may experience a single symptom, like constipation, while others report having cramping or straining with minimal release of stool. Some patients, on the other hand, experience diarrhea, while others endure alternate constipation and diarrhea. While many cases of this syndrome are regularly reported worldwide, there are still no known causes that would determine the proper treatments. IBS is frequently linked with bacterial infection found in the gastrointestinal tract. Researchers observed that people who have developed gastroenteritis have greater likelihood of also developing IBS. In addition, it is found that IBS is heightened by anxiety and stress. Other studies have linked IBS and celiac disease, which is the inability of a person to digest gluten. Patients of celiac disease have immune systems that respond to gluten by damaging the small intestine. Nevertheless, people have practiced a number of treatments to help provide temporary treatment for IBS, including avoiding large meals, caffeine, alcohol, and wheat-based products. Since IBS is believed to be associated with how the colon reacts to foods and stress, there are IBS diets and techniques developed to help those who are affected with this disorder. The best diet to control IBS is to eat foods that are rich in fiber, since it softens stools and makes it easier to have a bowel movement. There are lots of food sources where one can get fibers such as breads, fruits, beans, and vegetables. However, make sure to slowly introduce fiber in your diet to help your body get accustomed to it and to prevent gas pain that may induce IBS symptoms. Reports on IBS attacks suggest that certain foods and beverages that cause chemical interaction in the intestinal tract or can help change the movements in the colon may also trigger the symptoms. To keep track of foods that irritate your colon, you can keep a journal of your daily food intake and check which foods seem to trigger the symptoms. If there are foods that cause the flare-up of symptoms, you can adjust your intake and supplement them with other foods that do not have the same effects on your disorder. This activity will provide your doctor with substantial information that will lead to a well-designed treatment based on your personal needs. A dietitian can help in creating a balanced diet for you while getting around the possibility of triggering attacks. In addition to improper diet, stress is related with this syndrome. Patients are often advised of staying away from stressful situations, or at least create a plan of managing stress. This advice is based on reports that most patients experience attacks of symptoms after a stressful activity. Apart from avoiding problematic foods and stress management, you might also practice healthful drinking. Drinking plenty of water along with an increase of fiber intake proves to be helpful in lessening your susceptibility to reoccurrence of symptoms. This is most effective when the prevailing symptom is constipation. For more information and additional help on managing IBS, please visit irritableboweldiet.net for a comprehensive e-course and book on keeping your symptoms subsided. The package provides a complete diet and program for easing your pain and discomfort and enabling you to get back to your old lifestyle. I hope this package I've made available to you brings you the same relief it has brought others. Thank you for watching another one of my videos. Take care and stay healthy.